Hi, I'm Susie Sell. I'm here in Vauxhall at Dr Clare Gerada's GP surgery. Earlier I talked to her about the government's reactions to the RCGP's concerns about the reforms. The RCGP and other organisations have all voiced concerns about the reforms. Do you think that the government is listening to those concerns?
Well, certainly looking at the command paper, there didn't appear to be much change following our quite extensive consultation and document that we sent up to them. There's still many issues in the command paper that we're concerned about, and also we're still concerned about the pace and the extent of change. I think over the last few days in the media there have been some issues raised which have reassured us slightly, in particular Mr Cameron and the Prime Minister's assurance that the principles of the NHS are going to be retained. That's the principles of free at the point of use, irrespective of your ability to pay. And by that I also understand that we're not going to have top-up fees for cancer drugs, which of course was postulated with the last government, and we're not going to have additional costs for, say, for example, patients in maternity services for having midwives of their choice. So there have been some issues that have been reassuring, but there are still concerns, and I was particularly worried yesterday when I heard Stephen Dorrell talk on the radio and equating the need to make £20 billion savings with GP commissioning, implying that it's actually going to be GPs that are going to have to make those savings. Now, I understood that these reforms were about putting GPs in the centre of planning healthcare for their patients, not about making radical cuts, sweeping cuts, which will include shutting hospitals, making enormous redundancies, closing services. So, I've always tried to separate out the two issues, and I think it's going to be very obvious now that GP's role in commissioning, certainly for the first few years, is about cutting services. There might be some service redesign, but I would be worried that they're going to be able to make the savings that are going to be able to provide services that we want to be seen in the community.
So, in light of your concerns, do you think the government should have gone further to change its proposals?
With respect to the government changing tack, well, I would hope that a mature government would listen to the concerns. And it's not just the Royal College of GPs that have been voicing these concerns. I've been following this now for 6 months, and it's more or less every single body I've heard. So the King's Fund, the other think tanks, other Royal Colleges, the unions, the BMA, patient associations. My postbag is full from members of the public. So I would hope that, as I said, a mature government would take stock and follow through some of the things that they need to do. The NHS needs reform, but maybe just to say, well, what are we doing? Can some of these be maybe addressed through different ways? For example, merging PCTs, capping the amount of management cost at PCT level, and putting GPs on the majority of the board of a PCT.
So what would your message to the government be now?
My message would be, look, I think every government starts off and always has the best interests of the population at heart. That's why they become politicians. They're there because they want to make things better. So I think as the health bill passes through, it's actually to listen to the constituencies, to listen to parliamentarians, to listen to people like myself and other Royal Colleges and other senior professionals. In the end, they may choose to go ahead, come what may, and that's their choice. We have a democratic country, and there are democratic elected leaders, and we at the college and everyone else will help make this work. But my message is to Mr Cameron and to Mr Lansley is, please listen to our concerns. This is not ideology. This is because we have patients heart in at best. We want to make things better for patients. This isn't about buildings. This isn't about designing health services around buildings or around providers. This is about making sure that we put systems in place that work for patients.